Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about Guillain-Barre Syndrome. So with neuropathy, there are multiple different genetic disease processes that can actually cause a peripheral neuropathy as well. So let me give you insights into one of these, the Guillain-Barre Syndrome itself. This is a subacute, progressive, usually symmetric limb weakness that includes paresthesias or numbness and tingling to the fingers and the toes, and often a reduced or absent deep tendon reflex. And this usually presents in previously healthy individuals, so it kind of comes on pretty quickly over a period of time. And it's really the most common cause of paralysis in Western countries since the eradication of polio from vaccination. So, presentation. As you go around the country, around the world, the presentation kind of stays pretty consistent at 0.6 to 1.9 cases per 100,000 population. It affects all ages, race, and all economic levels, although there's a slight peak, a slight increase in the ages of 30 to 50, especially right around the age of 45. The most common presentation, if you had to move it one or the other, it's going to be slightly increased in the white or Caucasian individuals, and it's got a slight predominance in males over females. So what is the presentation? Well, it's actually a sensory abnormality, or with 85% of the time it's going to have paresthesias to the fingers and the toes. You have a weakness where often it's the legs that are weaker than the arms. You can have facial weakness. You have pain in about 30% of the individuals, and you can have autonomic abnormalities, including such things as respiratory failure, sinus tachycardia, bradycardia, and even ventricular arrhythmias. If you're sitting here in the situation, you say, okay, do I have Guillain-Barre syndrome? It's possible. You're going to usually have a progressive weakness in both arms and legs. You're going to have the areflexia, or the absence of the deep tendon reflexes. You're going to have progressive symptoms over days to 4 weeks. So like we said, you start as a healthy individual, and over a series of days or over a period of weeks, you start to get progressive symptoms. You have pretty relatively symmetric presentations of the symptoms, where one leg is the same as the other leg and one arm is the same as the other arm, or at least very similar. If you have a one-sided presentation or asymmetry, it's usually an indication that it is not Guillain-Barre syndrome. Often you'll start with mild sensory signs and symptoms. You can have cranial nerve involvement, which is why we can have a lot of times have the facial weakness or facial abnormalities. You can have a recovery beginning 2 to 4 weeks after the progression ceases, so it gets bad and it kind of goes back away, and there is no fever or other systemic symptoms that could indicate something else. So how is it diagnosed? We usually will do lab testing. A lot of times you'll do spinal fluid studies, and then you're going to, of course, as with other peripheral neuropathy type symptoms, you're going to do a nerve conduction and EMG studies. Treatments may consist of anything from IVIG, which is immunosuppressive type therapy, plasma exchange, and possibly even hospitalization if the symptoms get bad enough, because of the autonomic changes where you're worried about death, really. So if you're worried that you may have Guillain-Barre syndrome, it is important that you get diagnosed and you get evaluated, and they rule out some of the other causes, including viral infection or bacterial infections or systemic illnesses like lymphoma or sarcoidosis, leukemia. You're basically saying, okay, I want to confirm that it really is this, because there are some pretty successful and good treatments that can help move things backwards if that's what's presenting as your peripheral neuropathy. So this is Dr. Brandt Gibson, and we just talked to you about Guillain-Barre syndrome. This is your Neuropathy Nugget, day 95.